Measles Outbreak Surpasses 2,000 Eradication Record, What You Need to Know. U.S. measles cases hit record high, Vaccine Misinformation Fuels Outbreaks 2025 Health Crisis. Measles outbreak nears record, what's fueling the surge in the U.S.? Measles Outbreak Surpasses 2,000 Eradication Record, What You Need to Know. The measles epidemic is back, understanding the crisis and how to protect yourself. The United States is witnessing a surge in measles cases, with the current outbreak being the worst since the disease was declared eradicated in 2000. As we approach the midpoint of 2025, the number of reported cases has already exceeded the peak recorded in 2019, with a total of 1,277 confirmed cases as of July 5, according to data from the Johns Hopkins University Center for Outbreak Response Innovation. But here's where it gets concerning. The majority of these cases are linked to a large outbreak in West Texas, highlighting the need for immediate attention and action. The Centers for Disease Control and Prevention, CDC, reports that other cases have resulted from community transmission or travel-related exposure. The outbreak has led to at least 155 hospitalizations, with 431 adults and 824 children affected, and tragically, there have been 3 confirmed deaths. The virus is highly contagious, with 92% of unvaccinated individuals contracting the disease upon exposure, and 1 in 5 requiring hospitalization. The CDC notes that measles symptoms typically appear 7 to 14 days after exposure and include high fever, cough, runny nose, and watery eyes, followed by a rash 3 to 5 days later. Other signs include Koplik spots and small raised bumps on the skin. To combat this outbreak, it's crucial to understand the symptoms and take preventive measures. The measles outbreak has been reported in 39 states and jurisdictions, with Texas, New Mexico, and Kansas being the most affected. In Texas alone, 36 counties have reported cases, with 753 confirmed cases and 2 deaths among school-age children. So, what can you do to protect yourself and others? Knowing the symptoms and getting vaccinated are key. The CDC emphasizes the importance of vaccination in preventing the spread of measles. As the situation continues to unfold, it's essential to stay informed and take necessary precautions. But here's a question for you: are current vaccination policies sufficient to tackle outbreaks like this, or is there a need for a more comprehensive approach? Share your thoughts in the comments below. U.S. measles cases hit record high, Vaccine Misinformation Fuels Outbreaks 2025 Health Crisis. The United States is facing a significant public health crisis as measles cases have surged to an alarming record high, the highest since the disease was declared eliminated in the country. This troubling trend is largely attributed to declining vaccination rates among children and a persistent outbreak that originated in an area of West Texas where vaccination coverage is notably low. As of 2025, there have been at least 1,277 confirmed cases of measles reported in the U.S., according to data from the Johns Hopkins University Center for Outbreak Response Innovation. Remarkably, this figure has already surpassed the previous record set in 2019, which saw a total of 1,274 cases, and we are only halfway through the year. Experts caution that the actual number of cases this year may be significantly underreported, as many instances go unrecorded. Tragically, 3 individuals have succumbed to measles this year, 2 children in Texas and 1 adult in New Mexico, all of whom were unvaccinated. This unfortunate statistic matches the total number of measles-related deaths in the U.S. over the past 25 years. Measles was officially declared eliminated in the U.S. in 2000, meaning there had been no continuous transmission for over a year. This achievement was hailed as a monumental public health success by the U.S. Centers for Disease Control and Prevention, CDC, largely made possible by the development of effective vaccines. The measles mumps rubella, MMR, a vaccine, which is the most widely used, became available in the U.S. during the 1970s. Historically, prior to this year, the average number of measles cases reported annually since the elimination declaration was around 180, according to CDC statistics. In 2019, significant outbreaks in New York posed a threat to this elimination status, particularly affecting Orthodox Jewish communities in Brooklyn and Rockland County, which had been targeted by anti-vaccine misinformation campaigns for years. This year, Texas has reported the majority of measles cases, with over 750 confirmed cases linked to a single outbreak that began in late January. If the number of cases from this outbreak continues to rise into January of the following year, the U.S. risks losing its measles elimination status. A significant portion of these cases, over 400, has been reported in Gaines County, where vaccination rates are alarmingly low. In the 2024-25 school year, nearly 25% of kindergartners in Gaines County did not receive their required MMR vaccine, making it one of the worst vaccination rates in the state. Additionally, dozens of cases in New Mexico and Oklahoma have been traced back to the West Texas outbreak, and there are indications that cases reported in Kansas may also be related. In response to the outbreak, special vaccination clinics have been established, providing additional coverage for thousands of individuals. Many affected counties have also revised their vaccination guidelines, allowing infants to receive their first shot as early as 6 months instead of waiting until they are 1 year old. In New Mexico, the number of MMR vaccines administered this year has nearly doubled compared to the same time last year. A recent analysis of health records by Truveta, a healthcare data and analytics firm, indicates that early vaccination rates among infants in Texas have surged. This year, MMR vaccination rates for 6-month-olds in Texas are over 8 times higher than in 2019, and during March and April, approximately 20% of children who received their first measles shot did so before their first birthday. However, while the rate of new cases from the West Texas outbreak has slowed, cases continue to rise across the nation. There have been at least 27 outbreaks, defined as 3 or more related cases, reported, with at least 38 states confirming at least one case this year. In Colorado, cases spiked last month when an infectious traveler flew into the state, resulting in multiple cases among passengers on the same flight and others in the airport, leading to broader community transmission. Some cases in Colorado have also been linked to travel to Chihuahua, Mexico, where a significant outbreak is affecting the local Mennonite population. Furthermore, a large outbreak is occurring in Ontario, Canada, which has been associated with multiple cases in Michigan. Tragically, at least one person has died from measles in Canada this year, and there have been 9 deaths reported in Mexico. In April, Mexico issued a travel warning for individuals heading to the US and Canada due to the high rates of measles cases. The CDC has also intensified its travel advisories, recommending that anyone traveling internationally be vaccinated with 2 doses of the MMR vaccine. The overwhelming majority of measles cases in the US this year have occurred among unvaccinated individuals. Only about 8% of confirmed cases involved people who had received 1 or 2 doses of the MMR vaccine. According to CDC data, at least 155 individuals with measles, approximately 1 in 8 cases, have been hospitalized this year, with 28% of cases occurring in children under 5 years old. The MMR vaccine is both safe and highly effective. 1 dose is 93% effective against measles, while 2 doses increase effectiveness to 97%. However, measles remains one of the most contagious diseases globally. The U.S. Department of Health and Human Services has set a target for at least 95% of kindergarten children to receive 2 doses of the MMR vaccine, a crucial threshold for preventing outbreaks of this highly contagious disease. Unfortunately, the U.S. has fallen short of this goal for consecutive years. A record number of kindergartners in the U.S. received exemptions from required vaccinations during the 2023-24 school year, leaving over 125,000 new school children without coverage for at least one state-mandated vaccine. When the measles case count reached its previous record in 2019, both the HHS Secretary and CDC Director at the time emphasized the safety and effectiveness of the MMR vaccine, urging Americans to get vaccinated. However, the CDC currently lacks a director, and HHS Secretary Robert F. Kennedy Jr. has a complex and controversial history with measles vaccines. In April, when the U.S. had around 600 measles cases, Kennedy made a strong endorsement of vaccination, which starkly contrasted with his previous opposition to measles vaccines. Last month, he also dismissed an expert panel of vaccine advisors that has historically guided federal vaccine recommendations, a move that raised concerns among public health officials nationwide. Dr. Bruce A. Scott, president of the American Medical Association, expressed concern, stating, with an ongoing measles outbreak and routine child vaccination rates declining, this move will further fuel the spread of vaccine-preventable illnesses. Measles outbreak nears record. What's fueling the surge in the US? The US is on the brink of shattering a disturbing record for measles cases, and it's a crisis we thought we'd left behind. Here's why this resurgence should alarm all of us. In its latest update, the CDC confirmed 40 new measles infections, bringing the 2025 total to 1,267. That's just 8 cases shy of surpassing 2019's tally, the highest since the virus was declared eliminated in 2000. But here's where it gets controversial. While the massive West Texas outbreak has slowed, smaller hotspots and travel-linked cases are surging. The CDC now reports 27 active outbreaks nationwide, a stark jump from 16 in all of 2024. A whopping 88% of cases this year are tied to these outbreaks, proving how quickly the virus exploits gaps in immunity. This isn't just an American problem. The Pan American Health Organization, PAHO, revealed a staggering 29-fold spike in measles cases across the Americas this year, with Canada and Mexico battling historic surges. Canada's 3,170 cases, including 1 death, mark its worst outbreak since elimination in 1998, while Mexico's 2,597 cases, with 9 fatalities, are concentrated in Chihuahua. Both countries, like the US, are grappling with outbreaks fueled by low vaccination rates in tight-knit communities, such as Mennonite groups. But outbreaks can ignite anywhere vaccination coverage phrase, a warning for all regions. Wyoming just reported its first measles case in 15 years, an unvaccinated child who may have exposed others in a Casper emergency room. Measles is a preventable crisis, urges Dr. Alexia Harris, Wyoming State Health Officer. 2 doses of the MMR vaccine offer 97% protection. This isn't just about personal choice, it's about protecting those who can't vaccinate. Yet with 30% of patients unvaccinated, and 65% of cases lacking vaccination data, the question lingers, are we prioritizing community safety or individual preferences? Meanwhile, Utah, Michigan, Florida, and Kansas reported new cases, many linked to travel or the Texas outbreak. Utah's total climbed to 9, Michigan's to 17, and Kansas now has 83 cases, mostly tied to a sprawling 11-county outbreak. Florida's 3rd case, a young adult exposed abroad, underscores how global travel accelerates spread. So, what's the real solution? Health experts stress vaccination, but pockets of hesitancy persist. And this is the part most people miss: measles doesn't discriminate. It thrives in vulnerability, whether in insular communities or busy airports. As cases climb, one thing's clear: this isn't just a measles outbreak, it's a test of our collective responsibility. Should vaccination be mandatory in crisis zones? Do travel restrictions help, or do they distract from systemic gaps in healthcare access? Share your thoughts below, because solving this requires more than science, it demands tough conversations. The clock is ticking. Will we act before the record shatters? Measles Outbreak Surpasses.